Good morning, everyone. It is 9:01, so we will go ahead and get started. I am Rachel Sporletter, Benefits Team Lead here with Larimer County. Thank you for joining us for this webinar with the move to VOYA. We have VOYA on the line with us who will be going over the different plans that we've selected for the July 1st effective date. And then I will go over how to complete enrollment. Since this is a webinar, you guys are all muted and cannot unmute. Questions are best input via chat or the Q&A. So Jennifer and myself will be watching that if you have any questions. This will be recorded and posted later. So if you do have to sign off early for any reason, this will be posted later to our website. And then Nectar Points will be awarded to anyone who attends as soon as this wraps up. I can get those awarded hopefully by the end of the week. All right, with that, thank you, VOYA, for joining us. Some of you might be familiar with VOYA as we used to be with them, and we are happy to make this move back. So with that, Chantal, I'll hand it over to you.
Thank you so much, Rachel. Appreciate your invitation today. Happy to join the team, and good morning, all. My name is Chantal, and I am a client relationship manager with VOYA Employee Benefits. Today, I'm going to review the benefit options offered by Larimer County through VOYA Health Solutions, and we're sometimes referred to as VOYA Employee Benefits. So I will be both your host and your moderator today. But as Rachel mentioned, please feel free to submit your questions along the way via chat, and we will answer them as quickly as we can, so long as we have time to address them today. And I know Rachel will be peppering me with some questions throughout our session today as well. So this session is designed to educate you on the benefit options offered in this year's special enrollment by VOYA Employee Benefits. This insurance is offered by VOYA Health Solutions and is underwritten by ReliStar Life Insurance Company, which is a member of the VOYA family companies, but for any specific pricing, policy provisions, or benefit options, please be sure to refer to your enrollment materials that are available through your employer. And as Rachel mentioned, this session is being recorded and will be available for reference during the special enrollment. But again, as a reminder, refer to your enrollment materials or your human resources team for additional questions as well. So now that we have those public service announcements out of the way, let's go ahead and jump on in and get started. So I'm going to start off with critical illness insurance, and this is an interesting statistic that wasn't sure if you knew that in the United States, someone has a heart attack every 40 seconds. And there are more than just medical bills to pay after a heart attack or a stroke or any other unexpected covered medical condition. And critical illness insurance provides a benefit payment that can certainly help. Critical illness insurance doesn't replace your medical coverage. The benefit payments that are paid from the policy, they don't go out to pay for medical bills or treatments you may need. Instead, those benefit payments are sent directly to you, and you can use those monies however you like. So for example, if you needed assistance with paying the mortgage payment or rent, car payment, gas, groceries, again, you can use the benefit payments however you would like. Also, critical illness insurance is guaranteed issued. And what I mean by that is that means that there's no pre-existing condition exclusions nor medical questionnaires that you have to answer in order to give coverage, ever. So how does it work? We refer to the covered illnesses and conditions. We break them out into groupings we refer to as modules. And the benefits are payable at 100% of the benefit amount that you elect. And we'll go through those options here in a few minutes. But they're paid at 100% of the benefit amount that you elect unless otherwise noted. So here's just a few examples of the critical illness diagnoses that are covered underneath the plan, such as a heart attack or a stroke, cancer or a stroke, type 1 diabetes. Let me get my red pen out here. I'll point out a few type 1 diabetes. And then on the next page here, I've listed some additional ones that are included under the policy as well. So for example, ALS or Parkinson's disease, Alzheimer's disease are also covered underneath the plan. Additionally, you'll notice some of these, as I mentioned before, if they're not paid at the 100% of the benefit amount at you elect, it will be noted. So for example, if you're diagnosed with skin cancer, that benefit amount is actually 10% of the benefit amount you elect. And there are some others here, such as infectious disease, that are also insured, but at the 25% of the benefit amount you elect. But the others where it's not noted, the critical illness diagnosis would pay out at 100% of the benefit amount you elect. So how much does it cost and who's eligible to enroll? So I'm going to start out on the right-hand side of the screen here, talking about eligibility requirements and benefit amounts that are available to you. So that you must be an active employee, actively at work employee, full-time, working at least 20 hours per week, or maybe you're an elected official. And you then are eligible to enroll in coverage and can elect either $10,000, $20,000, $30,000, or $40,000 in coverage. And if you have coverage on yourself, you can also elect coverage for your spouse. Your spouse, those amounts available to your spouse are the same, the 10, 20, 30, or 40,000 in coverage, up to 100% of the employee's elected benefit amount. And children are also eligible to enroll as long as the employee is participating in the plan. And the benefits amounts available to the children are $5,000, $10,000, or you can choose 15 or 20,000, up to 50% of the employee's elected benefit amount. So a couple of additional details I want to share with you here with regards to eligibility. There may have some circumstances where we have two employees of Larimer County that just so happen to be married. So if that is the case, if you have coverage on yourself and your spouse is covered under the plan as an employee as well, you cannot insure your spouse as a dependent at the same time. So just keep that in mind. You can't be insured as an employee and a dependent at the same time. Another thing too, with regards to children, again, if you're enrolled into the plan as the employee, your natural children, stepchildren, adopted children, or children who you are legal guardian of can be covered up to age 26. And then also too, let's say if you have more than one child, maybe you have 3 children in the family. Well, one premium amount covers all of your eligible children. So for example, if you do have 3 children in your family, they're all covered for the price of one. But if both you and your spouse are covered under the policy as an employee, then only one of you, but not both, may cover the same children under the benefit. But if the parent who is covering the children stops being insured as the employee, then the other parent can apply for children's coverage. And then as far as the cost is concerned, it would depend on how much coverage you elect. And the rates shown here are monthly rates. So I'm just going to give you an example here. So if I'm in the age band of 40 to 44, and let's say if I want to elect $20,000 in coverage, That amount is a premium payment, which is payroll deducted, is $9.60 a month, and that would include the cost of a child or children. As for the same age band for spouse coverage, again, 20,000 in coverage is $9.60 a month for the spouse. So it depends on your age band and the amount you can choose, but those payroll deducted amounts are listed there. As far as some examples, as benefit payments are concerned, if one of these events happens on or after your coverage effective date and your claim is approved, again, benefits are payable at 100% of the critical illness amount that you elect unless noted otherwise. So just as a reminder that these benefit payments you can use however you'd like. They don't offset with any medical or healthcare benefits from other insurance policies. These benefit payments from the critical illness plan are actually in addition to any benefits that you receive from other healthcare insurance policies. And again, as a reminder, you can use these monies however you'd like. The payment is sent directly to you. So as an example, if I was an employee of Larimer County and enrolled in $40,000 of coverage and I had suffered a heart attack, that's paid at 100%. So my benefit check would be $40,000. Same for cancer. If I received a cancer diagnosis on or after my coverage effective date, my benefit amount is $40,000. However, for coronary artery bypass, that benefit amount is 25%. So if I received that diagnosis, then my benefit amount actually would be $10,000 in this example. And I've got a couple of other examples here to share with you as well. So meet the McCanns. In this example, Mike works full-time and his wife, Molly, stays at home with their 2 children. Mike had enrolled in critical illness coverage through his employer, and he also elected coverage for his spouse, for Molly. She experienced a heart attack, which is a covered condition underneath the plan and is expected to make a full recovery. But after a claim was filed and was approved, the paid benefit that the McCanns received helped them to cover out-of-pocket living and other expenses. So while Molly continued her treatment. So that's just one example. Another example that I'm often asked about is with regards to cancer diagnosis. So I'll share with you, let's say if I was previously diagnosed with breast cancer, and I had decided to enroll in the VOYA critical illness plan, and I received a second breast cancer diagnosis or a different cancer diagnosis on or after my coverage effective date, VOYA's policy would respond. I would receive a benefit for that second cancer diagnosis. And let's say if I was diagnosed with, again, this is just an example, cancer of the liver. Let's say if I was diagnosed with liver cancer on or after my coverage effective date, but that cancer had spread to a different part of the body. And 2 months later, I was diagnosed with bone cancer, then the policy would pay for a second cancer benefit because of that bone cancer diagnosis. So the second diagnosis would be paid. And again, just want to reiterate that the critical illness policy does not include a pre-existing condition exclusion. So the benefits are triggered based on your diagnosis of the critical illness being on or after your coverage effective date. Okay, so that was a lot of information to share. Rachel, if you don't mind, I'm just going to pause now to see if we have any specific questions about the information I've presented so far.
Yeah, Chantal, we actually do. If you'll go back one slide.
Sure, happy to do so.
Be 2 where it showed all the different, right here, perfect. So the question is the asterisk about heart attack. Is cardiac arrest not covered since the note says it's not considered a heart attack?
It is actually cardiac arrest is covered underneath the plan. So the differentiator here is that, and I'm not a medical doctor here, Rachel, but my understanding is one has to do with plumbing and the other one has to do with the electrical part function of the hearts. But if the diagnosis was considered a cardiac arrest, we would still pay at 100% of the benefit election.
Great. I think it just comes down to the coding and what's in the medical, your physician's notes when you file
Correct.
the claim. So, uh,
Exactly.
yeah, great. That's all I have for now.
Okay. Good
Thank
deal.
you.
All right. Well, with that being said, then what I'm going to do is go ahead and switch over to accident insurance. And so, statistics say that among financially stressed employees, 49% of them said that money worries had a severe impact on either their medical mental health, I should say, or their work productivity. 67% surveyed as being struggling to meet their household expenses on time each month, and 1 out of 4 either had to dip into the retirement savings or just postpone retirement altogether to help pay for medical bills. And then also, too, the CDC estimated unintentional falls were the leading cause of injuries treated in emergency departments. So whether you're cleaning the gutters or something happened at yoga class, soccer practice, life offers plenty of opportunities for accidental injuries, and accident insurance can certainly help. Accident insurance pays benefits for specific injuries and events resulting from a covered accident, and the amounts will depend on the medical services received, and I'll go through some examples of that. But please keep in mind that accident insurance is guaranteed issued, and there is no health questionnaire at all in order to be eligible for coverage. So, how much does it cost? There's no age component. Unlike the critical illness plan, there is no age component with regards to the cost associated with the accident coverage. So, if you're choose to elect employee only coverage, that monthly rate is $8.56. For employee spouse, it's $13.32. Employee and children, $15.68, or if you want full family coverage, it's $20.44 a month. And just like I mentioned on the critical illness plan, again, if you have coverage on yourself as an employee, and your spouse, who also happens to be an employee of Larimer County, if your spouse is enrolled as an employee underneath the accident plan too, you cannot enroll your spouse as a dependent under your policy. So again, and hopefully that's not confusing, but you cannot be enrolled as an employee and a dependent at the same time. And then for your children, just like the critical illness plan, it covers your children for anyone whom you are a legal guardian of up to the age of 26, and that their children, just as your spouse, are covered for the same benefit amounts as you are. And one premium amount will cover all your children. So whether you have 3 children in your family, or maybe even 4, you're still charged the $15.68 if you enroll just in employee and children coverage. Or again, for family coverage, it's $20.44 a month, regardless of how many children are insured underneath the policy. But as I mentioned on the critical illness plan, again, just want to reiterate that if both you and your spouse is enrolled as an employee on the plan, only one of you can insure the children. So what's covered? This is just a sampling, and I'm talking just a sampling of the medical services that are covered underneath the accident insurance plan. So you will be required to seek care for your injury within a set amount of time from the accident. And there are some standards, exclusions, and limitations, and I'll touch base on that here in the next few slides. But just keep in mind, just like the critical illness plan, the accident insurance pays you benefits for specific injuries and events resulting from a covered accident. It is 24-hour coverage, and those benefits are paid directly to you. They do not go to the hospital or the doctor's office to pay for medical bills. These benefit payments go directly to you. They are not offset by any other medical or healthcare insurance policy or payments whatsoever. And you can use the monies however you'd like. So, for example, if I was let's say I was in a car accident and I had to go to the emergency room. So that benefit amount for that treatment is $325. And then I had to have stitches. Because of the number or length of my stitches, I got a $750 benefit. And then I had it was deemed that I had a fracture, a broken leg. So without surgery, it's a $2,700 benefit. With surgery, it was a $5,400 benefit. So on and on. So the benefits stack on top of each other, and there's no limit to the benefits that are paid underneath the policy. So if I received all of these medical treatments, I would get a benefit payment for each one of them. Physical therapy is also included. It's paid up to 10 times per covered accident at $60 each. Follow-up doctor treatment, $125. So again, this is just a very short listing of the number of medical services that are covered underneath the plan. Eligibility, much like the critical illness plan, the employee needs to be actively employed, full-time, working at least 20 hours per week, or you may be an elected official. As long as you're enrolled, your spouse is eligible to participate in the plan as well, and so are your children. And I know we already covered the details with regards to the children whom you're a legal guardian of up to age 26. And what else is included in the plan? Well, there's a sports accident benefit. So let's say if there was an accident during an organized sporting event, like a soccer match, for example, we will pay additional benefits because of those injuries and the medical services received. There is a wellness benefit that's included. I'm going to go into deep detail on that here in the next couple of slides. But for continuation of insurance, let's say if there's certain circumstances where you're on an approved leave of absence, and depending on that, what type of leave of absence you are on, you can continue your coverage during that leave so long as policy premiums are paid. There is an accidental death and dismemberment benefit that's also included in the plan. And then also there's an additional, my gosh, this policy is loaded. There's a catastrophic accident coverage. So catastrophic meaning is that if you suffer a dismemberment, or if it's you're incapacitated, if you will, there's additional benefits that will be paid underneath the policy. So diving into that wellness benefit, if I had mentioned, the accident policy includes a wellness benefit of $75 for employees, $75 for spouses, and then $75 or 100% of your benefit amount per child, up to a maximum of $450 for all children. And how this wellness benefit is triggered is by going through a health pre-screening exam. So for example, whether you got an immunization, whether it be like a COVID vaccine or even a COVID test, or a flu shot, that would trigger the benefit. If you're having some type of blood test completed, like for cholesterol testing, for example, there's that under here as well. A breast ultrasound sonogram or even an MRI would trigger this benefit. And the one nice thing about these health pre-screenings, again, the benefit is designed for you to complete these health pre-screenings. So for any of, illnesses, et cetera, can be diagnosed early, because if diagnosed early, the chance of recovery is much better. Rather than having you wait. So this is encouraging you to go through those health pre-screenings. And if I can give you an example, I know we talked about the premium amounts for to enroll in the accident policy. For the premium amount for family coverage, again, that's the employee, the spouse, and your children, it was $20.44 a month. Or if I multiplied that by 12, it's $245.28 a year. But because you enrolled in the plan, whether or not you had an accident that would be covered underneath the policy, you are eligible for the wellness benefit. So if you did go through a health pre-screening, as the employee, your spouse did it well, and let's say if I had 2 children in my family, that's $75 each. So that's 4 family members total, and that would be a total of $300 in wellness benefits. So if my policy premiums are approximately $245, and if I filed my claims under the wellness benefit, I get $300 back. So it's really a no-brainer that the wellness benefit can potentially cover the cost of having accident insurance for you and your family for the entire year. One thing I also want to point out on the wellness benefit as well, it is paid out once per calendar year. So since the VOYA plan is starting on July 1st, you can file for a wellness benefit starting July 1st through December 31st of 2024. And then starting in January, since it's a new calendar year, you can file a claim for another wellness benefit if you're still enrolled in the plan. So you certainly can take advantage of that. And then this next slide as well goes through the wellness benefits. Some other items, health pre-screenings that are covered are like your routine dental exams, routine eye exams, or maybe a well child preventative exam was taken. Again, this is not an all-inclusive list of the health pre-screenings that would be eligible for that wellness benefit.
Chantal, can I jump in super quick here?
You bet. Go ahead.
So back to the wellness screenings,
Yes.
as she was just talking about, one of the qualified items here is a biometric screening, which, as you guys know, as employees, if you're on our medical plan, is required in order to get the wellness rate. So I actually file once the information gets into Navigate, our wellness portal. I will be filing those for employees and spouses on our medical plan. So similar to what I do now with Sun Life, same thing is going to occur with VOYA. I will be filing those. The ones you guys need to be worrying about is making sure to file for those kiddos. So children are the ones who I can't file for. We don't have any of their information, and spouses not covered on our medical plan, I don't have any information on. So wanted to just kind of confirm that. I did just get another question in about the premium for the employee only wellness. Wellness is not on its own, Sandra. Wellness is part of the accident plan. And I believe that monthly rate was $8.44, if memory serves.
Let me back up. You're $8.56.
$8.56 per month. So it is actually, these rates are lower than what we currently have with Sun Life. So not only are we able to kind of double dip in those wellness screenings this year, those wellness benefit. There's so many wellness benefits. I hate using that word. But we can double dip in Sun Life and VOYA for this year.
And
Another
Rachel,
question. Sorry, another question just came in for the wellness benefit. I met my deductible. Recently had an ultrasound. I think the HDHP is paying for the ultrasound. Would I be able to be reimbursed $75 for the wellness screening? So if you already had that done, that wouldn't be available through VOYA. So VOYA is anything July 1st and later. I don't believe that is a qualified wellness with Sun Life, but you can definitely file that. That's usually my response is file it and see what they say. But the bigger point I want to make here is, since the question is regards to the HDHP deductible, as Chantal said, there is no coordination between medical and accident plan. What that means in layman's terms is that even if you've had a really bad year and you've met your deductible, or you're on the choice plan and you've met your out-of-pocket max for the year, it doesn't matter. There's no coordination of benefits. What you'll do is, once you get a bill, and sorry to step on your toes here, Chantal, but once you get the bills, once you get the bills and you have CPT codes, that's what will be filed, and what the claims examiners at either site, whether it be Sun Life or VOYA, they look at those CPT codes to see what is to be paid. So you don't have to do the thinking for them. File the claim, upload the any itemized bills that include those CPT codes, and you'll be paid out the benefit schedule that Chantal was referring to earlier. So you don't even have to be on our medical plan to be eligible to enroll in the accident and critical illness.
That's right.
There's no qualified there also. So I hope that answered the question. I do have one other one that came in that said, I threw my back out. Would this be considered an accident? I'm happy to take a stab at that one. Or do you want to answer that, Chantal?
No, Rachel, go ahead. Go ahead, take a stab at it.
So my same answer, it would go back to, I threw my back out. To me, says accident. You don't throw your back out for fun. Usually it's not a procedure that you go and do. So that again would be under Sun Life, since you already did it and it's not after July 1st. If you're covered on the Sun Life plan, file that claim, get those documents necessary, the bills with CPT codes, and file that claim.
Yeah. And Rachel, you're spot on with that, with throwing out the back. So if, and it has to be due to a covered accident. What I mean by that, Rachel, is that maybe you slip and fell off the second step of a ladder, or you slipped on some ice walking down your driveway or in the grocery store, something along those lines. So if that is what caused your back injury, again, depending on the medical services received, if you had to go to the emergency room or had some other medical procedures, again, depending on the medical services received, there would be benefits payable underneath the policy. And Rachel, I did want to touch base with regards to the individual that asked about employee-only coverage and the wellness benefit. So Rachel, employee-only coverage, as we mentioned before, is the $8.56, which is monthly. So that'd be $102.72 a year. But if I file my wellness benefit, which is the $75 for employees, then essentially by taking that $75, applying it to your premiums, the employee-only coverage would only be costing you about $28 a year for coverage. I can't even fill my gas tank for $28. So hopefully, great questions. I love it. And hopefully, Rachel, that helps to answer some of those.
Yes, thank you.
Okay. Rachel, one other thing I wanted to mention, you had talked about filing claims. So for an accident claim, yes, as you had mentioned, with regards to that supporting medical documentation, whether it be a car accident or, like I said, you slipped off a ladder and you had to have stitches, or you had to have some medical services received because of the back injury. What will happen is that we'll ask for a copy of the hospital invoice, or the detail of all of the medical services you receive, because we're looking for all those medical services that we can pay benefits on. But as far as the wellness benefit is concerned, we do not need any supporting documentation in order to file a claim. All you need to do is go online and provide us with three pieces of information, which is the name, the date that you took the health pre-screening. So, for example, I had my eye exam just last month. So I need to provide VOYA with the date of my eye exam, the name of my eye doctor, and just indicate in the claim system that it was a routine eye exam that I had taken. No supporting medical documentation is needed for the wellness benefit only in order for us to pay out that wellness benefit claim. These are some great questions. Are there any others in the chat, Rachel? Or are we good to go on?
We just got one about how many health screening tests do we need to complete to receive the wellness benefit? Does our LC biometric screening alone cover this?
Yeah.
So that biometric screening covers it for us as employees and for our spouses. Kiddos obviously don't get those biometric screenings. And so well child exam qualifies.
Correct.
A dental exam, eye exam. And as Chantal mentioned, it's I call it kind of the honor system. There's no information, no EOBs or anything needed. But yes, it's only one test per covered member per calendar year.
Excellent. Great question.
That's it for now.
All right. No, I love the questions. This is wonderful. Wonderful. And since we're talking about paying claims, we do have two claim philosophies here at VOYA. The first one being product to product claims integration. And what that means is that you may file a claim under one of the policies, like the accident plan, but we'll look to see if possibly we could pay benefits under the critical illness policy as well, if you are enrolled in the critical illness plan. And I'll just give you an example. Let's say if you were in a car accident, you suffered permanent paralysis because of the car accident that occurred on or after your coverage effective date. So you sent in your medical invoicing that showed all the medical services you received because of your car accident, and we paid out the accident plan. But then the case specialists are trained to look for other coverages that you might be enrolled in, and to see if that same incident would trigger benefits underneath the other policy. Permanent paralysis, that is a covered critical illness diagnosis underneath your critical illness policy. So if you were, because of that same accident, you were permanently paralyzed, if you were enrolled in the critical illness plan, that policy would also pay benefits as well, even though it stemmed from the same accident that was paid underneath the accident plan. Another thing too, another claims philosophy we have here at VOYA is the intuitive claims payment model. So let's say, again, in that accident, that same car accident, and I just broken a leg, and I submitted all of my medical documentation, etc., but I didn't indicate that I required medical equipment because of that broken leg. Like, I'm going to need crutches. And even though that may not have been included, that line item may not have been included in the medical information that was received, VOYA knows, VOYA's claims analyst knows that you're going to need crutches or some sort of medical equipment if you have a broken leg. So even though we might not have the medical supporting documentation for that medical service, we're going to pay that portion of the claim regardless. And then here's just another claim example as well. I know we've been talking about a lot of claim examples. Rhonda, in this case, she had fell while she was carrying her groceries. She ended up in the emergency room and she had submitted an accident claim. She submitted the accident claim for her emergency room visit. She had have an x-ray and she ended up with a fractured foot, unfortunately. But Rhonda, because of those injuries, we would have anticipated Rhonda having to have follow-up doctor's visits and medical equipment. So she received a payment for not only her initial claim, but we also included the benefits for the follow-up doctor's visits and the medical equipment, even though we didn't have documentation yet to support those items. We just went ahead and paid the claim because we knew she was going to need that follow-up treatment. And finally, as far as those exclusion and limitations, there are some. I'll give you an example. If there was an accident and it was due to alcohol or drug abuse, let's say like a DUI, for example, medical services received because of an accident such as that would not be covered. Or maybe, for example, you thrill seekers out there that go hang gliding or bungee jumping or parachuting, if you suffered an accident because of those, what we would deem as high risk activities, those medical services would not be covered. Okay. And before I continue on, Rachel, I just want to do one final check-in to see if there were any more questions specific to the accident.
Nothing at this time.
Okay. So finally, to wrap up our conversation today, what's really important to VOYA is not only the benefits, that you understand the benefits that are available to you, but also too that when you do elect coverage, if you need to submit a claim, that claim process is easy. And so like we talked about the wellness benefit, we don't need supporting medical documentation that you took an eye exam or you had a dental exam. We just need the date of that service, the name of your doctor, and what kind of exam you took, and we'll pay the benefit. And you can do that easily online, electronically, by going to voya.com/claims, where you can submit that claim. It's all done electronically online. There's no paper forms to fill out. If you don't want to, some people feel a little bit more comfortable filling out paper forms, which we will certainly accept those as well. The claim, though, once it's online and uploaded online, you will get an automated confirmation of receipt, which is great because sometimes when you're using paper forms, if you fax them in, it may be a few days before you hear that the claim has been received, where this is automatic. And then also, too, following the electronic submission of your claim, a few days later, you will get confirmation of what your claim number is. And then from there, you can use that same online VOYA Claim Center to track the status of your claim as well. And of course, VOYA contact information to our claims department is provided there too, if you have any additional questions about your claim submission. And finally, just some dates to remember. So your special enrollment period actually opened yesterday and is going through June the 13th. But please keep in mind that these benefits are effective starting July 1st and going forward. So in order to either make your elections, or if you do want to newly enroll in coverage, you'll need to log on to UKG, make your elections. But if you're currently enrolled in Sun Life and those plans, that enrollment will roll over to VOYA. So that enrollment and the plans will stay intact. But if you have any questions about your enrollment, you can always use your HR benefits team as a resource. For any general questions about the policies or the plans, you can reach out to the VOYA call center, and there's the toll-free number there. But if you happen to have your cell phone handy and can take a picture of this QR code, this website, our Employee Benefits Resource Center website, is designed specifically just for Larimer County employees. It includes highlights of the plans, employee brochures. There's even benefit videos out there that will help explain how the plans can benefit you. Explanation of the benefits. Oh, and you can actually start a claim once you're enrolled and it's a July 1st or afterwards. You can actually start a claim from that same website as well. So if you want to take a picture of that QR code with your cell phone, that will pop you right into that website. And I will leave this up here momentarily. Rachel, I know you wanted to add some closing remarks, and I also wanted to check in you one final time to see if there were any other questions.
No other questions at this time. But yeah, I was going to show a document that we created on how to complete this special enrollment. So
Excellent. I'll stop sharing, Rachel, there and let you take over.
Great. Thank you so much. Here is our little guide. We've been sending out lots of emails and communications. So this is also within that document. But you would just log into UKG, go to myself, manage my benefit, click on update benefits. Now during open enrollment, there's a big button about doing your enrollment. Since this is just a special enrollment, you will select special enrollment for accident and critical illness within this special life event list. It should be at the very top, so easy to find. It'll ask you for an event date and notes. You do not need to input any notes. You can choose today's date for the event date. You can also throw a T as in Tom in there and hit tab and it'll throw in today's date. So quick little shortcuts. And then you'll select continue, verify your personal info. You actually can't change anything in there. So just scroll to the bottom and select review my family. Add any family members that you should want to add in there. Shop for benefits. Scroll down to the accident and or critical illness plan that you wish to elect. This annoying pop-up will come up. We tried to get rid of this. It just would not allow us to. It'll come up, just select OK, and go on and proceed with your enrollment. If you are new to the accident plan, beneficiary information is required because there is an accidental death benefit associated with the accident plan. So don't be thrown off by that. It will also give you that message before you're able to continue on. And then once you have your elections confirmed, you'll simply do the review and check out and then check out again. If you are already enrolled and do not want to make any changes, you do not need to do anything. So, and then lastly, here is the website. If you did take a picture of that QR code that Chantel shared, this is the site that it's going to take you to. This is our Larimer County site, as you can see. If you want more specific information regarding the products, if you want to look at what wellness benefits are covered, again, there's a flyer here that talks about it. There's the actual policy. So if you're a policy person and you want to look through it, it's located there. Critical illness benefit, and then here's obviously the file a claim. Keep in mind, we've tried to add it 7/1, anything on or after July 1st is covered with VOYA. July 30th and before, June 30th or before is if you are currently enrolled with Sun Life. Rachel, I got stuck on the current benefit elections page and don't see VOYA listed. Tiffany, if you will email me a screenshot of that. Oh, never mind. I see it now. Great. Okay. But with that, I know we went a few minutes over. I apologize. I will stop my share now and open it up for questions. Anyone have anything for me or for the VOYA team? We do appreciate everyone's participation in this. We had great participation, great questions. Thank you, Linda and Chantal, for being here and presenting this. As I mentioned at the beginning, it was recorded, is being recorded, and we will get that posted and hope to get Nectar points awarded this week.
Thank you, Rachel, for having me. Certainly appreciate it.
Yes, thank you so much for being here and presenting. It doesn't look like we have any questions, so we will go ahead and wrap up. Thanks, everyone. Have a great day.